Looking for a safe and effective sleep aid? In this comprehensive guide, we will delve into the world of Ambien and expose its side effects. Whether you're already taking Ambien or considering it as a potential solution, it's important to understand the potential risks and benefits. Ambien is a widely prescribed sleep medication that helps millions of people overcome insomnia and achieve a restful night's sleep. However, as with any medication, there are potential side effects that need to be considered. From drowsiness and dizziness to more serious complications like sleepwalking and memory loss, we will cover everything you need to know to make an informed decision about using Ambien as a sleep aid. With our detailed analysis and expert insights, you'll gain a better understanding of Ambien's potential side effects and how to use it safely. We'll also provide you with valuable tips on maximizing the effectiveness of your sleep aid while minimizing any potential risks. Sleep tight knowing that you have all the information you need to make the best decision for your sleep health. What is Ambien and how does it work? Ambien, also known by its generic name zolpidem, is a sedative-hypnotic medication primarily used to treat insomnia. It belongs to a class of drugs called non-benzodiazepines, which work by enhancing the effects of the neurotransmitter gamma-aminobutyric acid, GABA, in the brain. GABA is responsible for reducing the excitability of neurons, thereby promoting relaxation and sleep. The medication comes in different forms, including immediate-release tablets, extended-release tablets, and sublingual tablets. The immediate-release tablets help you fall asleep faster, while the extended-release tablets help you stay asleep throughout the night. The sublingual tablets dissolve under your tongue and are useful for those who have difficulty swallowing. It's important to note that Ambien should only be used for short-term treatment of insomnia, typically for no more than 1 to 2 weeks. Prolonged use may lead to dependence and other adverse effects. Now that we have a basic understanding of Ambien, let's explore its common side effects. Common side effects of Ambien. While Ambien is generally well tolerated, there are some common side effects that you may experience. These side effects are usually mild and temporary, but it's essential to be aware of them. Common side effects of Ambien include drowsiness. Feeling excessively tired or sleepy during the day is a common side effect of Ambien. This can impair your ability to perform daily tasks and may pose a risk, especially when driving or operating heavy machinery. Dizziness. Some individuals may experience dizziness or lightheadedness after taking Ambien. It's important to be cautious when getting up from a lying or sitting position to prevent falls. Headache. Headaches are a common occurrence when starting Ambien, but they usually subside as your body adjusts to the medication. If headaches persist or worsen, consult your healthcare provider. Nausea and vomiting. Some individuals may experience gastrointestinal discomfort, including nausea and vomiting, as a side effect of Ambien. It is recommended to take the medication with a light snack or meal to minimize these symptoms. Dry mouth. Ambien can cause a dry sensation in the mouth, making it uncomfortable. Staying hydrated and sucking on ice chips or using artificial saliva products may help alleviate this side effect. Changes in appetite. Ambien may affect your appetite, leading to increased or decreased food intake. Monitoring your eating habits and discussing any significant changes with your healthcare provider is crucial. Remember that these side effects are usually temporary and may improve as your body adjusts to the medication. However, if any of these side effects persist or worsen over time, it's important to consult your healthcare provider for further evaluation. Serious side effects of Ambien. While uncommon, Ambien may also cause more severe side effects that require immediate medical attention. These serious side effects are relatively rare but should not be ignored. If you experience any of the following symptoms after taking Ambien, seek medical help right away. Allergic reactions. Some individuals may develop an allergic reaction to Ambien, characterized by symptoms such as hives, difficulty breathing, and swelling of the face, lips, tongue, or throat. If you experience any signs of an allergic reaction, seek emergency medical care immediately. Sleep-related behaviors. Ambien has been associated with unusual sleep-related behaviors, such as sleepwalking, sleep driving, and engaging in activities without full awareness or memory. These behaviors can be dangerous and may lead to accidents or injuries. If you or your loved ones notice any unusual sleep behaviors, discontinue Ambien and consult your healthcare provider. Memory problems. In some cases, Ambien may cause memory loss or memory impairment. This can range from mild forgetfulness to more severe difficulties in recalling past events or forming new memories. If you experience any significant memory problems while taking Ambien, discuss it with your healthcare provider. Mood and behavior changes. Ambien has been known to cause changes in mood, including aggression, agitation, irritability, and even worsening of depression. If you notice any significant changes in your mood or behavior while taking Ambien, it's important to seek medical advice. Respiratory depression. Although rare, Ambien can potentially cause respiratory depression, which is characterized by slowed or shallow breathing. This is more likely to occur if Ambien is taken in higher than recommended doses or when combined with other substances that depress the central nervous system, such as alcohol or opioids. If you experience difficulty breathing or notice a significant decrease in your breathing rate while taking Ambien, seek immediate medical attention. It's crucial to remember that while serious side effects of Ambien are relatively rare, they can occur. Being aware of these potential risks and seeking medical help when necessary is essential for your safety and well-being. In the next section, we will explore the risks associated with long-term Ambien use. Understanding the risks of long-term Ambien use. Ambien is intended for short-term use to treat insomnia. Long-term use of Ambien may increase the risk of developing dependence, tolerance, and rebound insomnia. Dependence occurs when your body becomes accustomed to the presence of Ambien and requires higher doses to achieve the same sleep-inducing effects. Tolerance develops when the medication becomes less effective over time, requiring higher doses to achieve the same results. Rebound insomnia is another potential risk associated with long-term Ambien use. When you stop taking Ambien after prolonged use, you may experience a worsening of insomnia symptoms, making it difficult to fall asleep or stay asleep. This is a result of the body's dependence on the medication to initiate and maintain sleep. Additionally, long-term use of Ambien may increase the risk of cognitive impairment, memory problems, and even mental health issues such as depression or anxiety. These risks are more pronounced in older adults or individuals with a history of substance abuse or mental health disorders. To minimize the risks associated with long-term Ambien use, it is important to follow the prescribed dosage and duration of treatment recommended by your healthcare provider. Regularly reassessing the need for Ambien and exploring alternative treatments for insomnia can also help reduce the potential risks associated with long-term use. In the next section, we will provide you with tips for safe and effective use of Ambien. Tips for safe and effective use of Ambien. Follow your healthcare provider's instructions. Always take Ambien exactly as prescribed by your healthcare provider. Do not take more than the recommended dose or use it for longer than advised. Take Ambien just before bedtime. Take Ambien right before you plan to go to bed. Avoid taking it earlier, as it may cause drowsiness and impair your ability to perform daily tasks. Create a conducive sleep environment. Make your bedroom a sleep-friendly environment by keeping it dark, quiet, and at a comfortable temperature. Remove any distractions that could interfere with your sleep. Avoid alcohol and other sedatives. Alcohol and other sedatives can enhance the sedative effects of Ambien, increasing the risk of side effects and respiratory depression. It's important to avoid consuming these substances while taking Ambien. Do not drive or operate machinery. Ambien can cause drowsiness and impair your ability to drive or operate machinery safely. Avoid engaging in activities that require mental alertness until you know how Ambien affects you. Limit caffeine and stimulant intake. Caffeine and other stimulants can interfere with sleep. It's advisable to limit your consumption, especially in the evening, to ensure a restful night's sleep. Gradually taper off Ambien. If you have been using Ambien for an extended period, it's best to work with your healthcare provider to gradually taper off the medication. Abruptly stopping Ambien can lead to withdrawal symptoms and rebound insomnia. Remember, these tips are meant to help you use Ambien safely and effectively. It's important to consult with your healthcare provider before making any changes to your medication regimen. In the next section, we will explore natural alternatives to Ambien for better sleep. Natural alternatives to Ambien for better sleep. While Ambien can be an effective sleep aid, some individuals may prefer to explore natural alternatives. Here are some natural options that may help improve sleep without the potential side effects associated with medication. Establish a bedtime routine. Creating a consistent bedtime routine helps signal your body that it's time to wind down and prepare for sleep. Engage in relaxing activities such as reading, taking a warm bath, or practicing deep breathing exercises. Practice good sleep hygiene. Good sleep hygiene involves adopting healthy habits that promote quality sleep. This includes maintaining a regular sleep schedule, avoiding stimulating activities before bed, and creating a comfortable sleep environment. Relaxation techniques. Incorporate relaxation techniques such as meditation, yoga, or progressive muscle relaxation into your daily routine. These practices can help reduce stress and promote relaxation, making it easier to fall asleep. Herbal remedies. Certain herbs, such as valerian root, chamomile, and lavender, have been used for centuries to promote sleep. These herbs can be consumed as teas, taken in supplement form, or used in essential oil diffusers. Cognitive behavioral therapy for insomnia, CBTI. CBTI is a non-medication approach to treating insomnia that focuses on changing negative thought patterns and behaviors related to sleep. It has been shown to be effective in improving sleep quality and can be an excellent alternative to medication. It's important to note that natural alternatives may not be as potent as medication like Ambien. However, they can be beneficial for individuals who prefer non-pharmacological approaches or those who may not be suitable candidates for medication. If you're considering natural alternatives, discussing them with your healthcare provider is essential to ensure they are safe and appropriate for your specific situation. In the next section, we will explore how to manage and alleviate Ambien side effects. How to manage and alleviate Ambien side effects. If you experience side effects while taking Ambien, there are several strategies you can try to manage and alleviate them. Here are some tips. Drowsiness. If you feel excessively tired or drowsy during the day, it may help to adjust your Ambien dosage or timing. Consult your healthcare provider for guidance on optimizing your medication regimen. Dizziness. To minimize dizziness, avoid sudden changes in position, especially when getting up from lying or sitting. Take your time and gradually rise to prevent falls. Headache. If you experience headaches, over-the-counter pain relievers such as acetaminophen or ibuprofen may provide relief. However, consult your healthcare provider before taking any new medications. Nausea and vomiting. Taking Ambien with a light snack or meal can help alleviate gastrointestinal discomfort. If nausea and vomiting persist, consult your healthcare provider for further evaluation. Dry mouth. Staying hydrated by drinking plenty of water can help relieve dry mouth. Sucking on ice chips or using artificial saliva products may also provide temporary relief. Changes in appetite. If Ambien affects your appetite, focus on maintaining a balanced diet and staying mindful of portion sizes. Consult a registered dietitian for personalized guidance if needed. Remember, it's important to consult your healthcare provider if you experience any significant or persistent side effects while taking Ambien. They can provide specific recommendations tailored to your individual needs. In the next section, we will discuss the importance of discussing Ambien with your healthcare provider. Discussing Ambien with your healthcare provider. Before starting or making any changes to your Ambien regimen, it is crucial to have a conversation with your healthcare provider. They can evaluate your specific sleep needs, assess your medical history, and provide personalized recommendations. Here are some reasons why discussing Ambien with your healthcare provider is important. Individualized treatment plan. Your healthcare provider can help determine if Ambien is the right choice for you based on your sleep patterns, medical history, and any pre-existing conditions or medications you may be taking. Dose adjustments. Your healthcare provider can prescribe the appropriate dosage of Ambien based on your specific needs. They can also help you adjust the dosage if you experience side effects or if the initial dose is not effective. Monitoring for interactions. Ambien can interact with other medications, including prescription, over-the-counter, and herbal supplements. Your healthcare provider can review your current medication regimen to ensure there are no potential interactions that could lead to adverse effects. Addressing underlying causes. Insomnia can be caused by various factors, including stress, anxiety, or underlying medical conditions. Your healthcare provider can help identify and address the underlying causes of your insomnia, providing a more comprehensive treatment plan. Regular follow-up. Regular follow-up appointments with your healthcare provider allow for ongoing monitoring of your sleep health and the effectiveness of Ambien. Any changes in your condition or medication regimen can be addressed promptly. Remember, your healthcare provider is your partner in managing your sleep health. Open and honest communication about your symptoms, concerns, and experiences with Ambien is essential for ensuring safe and effective treatment. Ambien and its potential interactions with other medications. Ambien can interact with other medications, potentially leading to adverse effects or reducing the effectiveness of either medication. It's crucial to inform your healthcare provider about all the medications you are taking, including prescription, over-the-counter, and herbal supplements.